Everyone, welcome to Intentional Health. Today we'll be talking about one of our favorite topics is really understanding what integrative medicine is all about and how is it different than your conventional medical experience, as in going to a primary care doctor's office. Zach, you want to start?
Sure, yeah. So a lot of people in integrative medicine actually were primary care doctors before they made the switch, or they actually still have primary care as part of their practice. So in many ways, integrative is really an extension of primary care. The main key difference to me is that we have the luxury of spending a lot more time with patients. Primary care doctors, they have like a long list of things they need to get through in a given visit, and especially, let's say, an annual. Talking about all your preventative care, your colonoscopy, mammograms, vaccinations, all these different things. I think there's a statistic out there that on average, a doctor interrupts a patient after only 17 seconds. And I think there's the reasons for that because there's so many different things that they have to get to in the visit. So we really have the luxury to spend the time with patients and really hear the whole story. And I think that can be really therapeutic in and of itself. It's rare that people have had an opportunity to really tell the entire story and really get into all the associated psychological and social aspects. So I'll leave it at that. I think that that's the main difference. We have a lot of time to spend with patients.
Yeah, that's really true. I think the story is the biggest part of our visit. So, yeah, I love listening to the story, and I think it's so beautiful at the end of the visit where the patient's like, "Oh, that feels so good to just get off my chest." And parts of the story, we're just collecting information the whole time and really trying to find the root cause of the problem. So I think what makes a difference in an integrative visit is that we don't just focus on the symptoms. We don't just want to throw a medication at a symptom to make you feel better and try to get you feel better right away. Yes, we want to get you to feel better, but really addressing the root cause is where we're going to make the biggest difference to make sure your symptom improves, gets better, completely goes away, but hopefully never comes back again. So that's when we talk about listening to the full story, that's what we're doing. But it's not just about the root cause, it's also about finding ways to make changes. So I think that most patients come into a doctor's office, they kind of know what they're supposed to be doing, but they just need some guidance on how to do it. A lot of patients come in with the motivation or they don't want a list of all these things they're supposed to do. They want to be told how to do them. How can I make this change? And maybe sometimes they don't even know some of the barriers to making those changes. So we've become experts almost at not even almost, we've become experts at helping patients make changes. We've heard thousands of stories. It's through experience in our training. Our training is different in that way. So I think the biggest difference I have made as an integrative physician compared to when I was just practicing internal medicine is to help patients realize that they have the motivation and that they can make change and help them get through the barriers to make change. So I would say that's probably the biggest difference in my practice as an integrative physician.
No, all that makes sense. And like you said, having time to spend with people is just a luxury these days in any setting, especially in a doctor's office. So I completely agree with that. And also, we're kind of like detectives, right? When someone comes to us, they share their story, and what we're also listening to is the story of the illness itself to figure out how did it start, what's the root cause, and how can we get out of it so we can help someone get to their optimal health. So when people ask us, do you treat thyroid conditions? Do you treat chronic fatigue? Or do you treat anxiety? I always say we don't treat any of these things. We treat people because everyone has their own unique story. And it's not just about the physical symptoms or the labels, because we all know that we cannot separate the body from the mind, the spirit, the community, the environment that surrounds us. That's just an extension of who we are. So if I really want to get to know someone, it's not just their physical ailments. It's also understanding what are they going through emotionally and spiritually. And I know everyone's going to, say a doctor talking about spirituality and your spiritual well-being, that's something new for sure. But just think about your own personal experience for a second. When you are not feeling 100% emotionally or spiritually, it affects how you feel physically, right? It's going to exacerbate the symptoms you already had, or it might give rise to new conditions. So, as a doctor, my job is to look at the whole person in front of me and listen to the whole story. So, it's truly an honor, a privilege, and a luxury to be able to practice medicine the way we all intend it to be. And I hope this becomes the gold standard, that integrative medicine is how medicine is actually practiced. So, let's end with that. Thank you so much.